everybody, and it is a good morning or a very good afternoon, I want to say. And I want to welcome you to our first ever virtual job fair that the CEC has put on. And I'm proud to say that it's going very well. And we're very happy to be putting this on, but we're very happy to have the employers who are participating, especially Interim Health. And I want to introduce to you Laura, and it's Croker. Is that exact? Is that how you pronounce your last name?
Yes, that was perfect.
Oh, perfect. Okay, good. And she is a recruiter. Is that correct?
Yes, I am a recruiter here.
Okay, for Interim Health. And I can tell you it's a very important industry, especially now with baby boomers getting older. And it's a huge market for healthcare. And I just really want to say thank you to those who are interested in it because it's so needed. Anyway, but we're so happy to have Interim. They are obviously great people. They're very nice people. So that's a good sign when you go and want to choose a company. And they have a lot to offer. So I am going to pass this on to Laura and have her explain who Interim is and what positions they are recruiting for, how to apply, etc. So you can take it over.
Awesome. Thank you, Mary.
You're welcome.
So here at Interim Healthcare, we are one of the leading providers in home care. So we go out to clients' homes and we take care of them. It's usually a one-on-one basis, and we take care of them. Sometimes it's a couple case, so there might be like a husband and wife, and we take care of them. We help them make their meals, light housekeeping, and walking with them, just simple things, so they can stay in their homes. A lot of these clients, they don't want to be in the hospital or a nursing home. So with here at Interim, we're able to keep clients in their home. So right now we're looking for caregivers. And the more caregivers we have, the more clients we can accept. So we're actively hiring. I would say I want to hire a handful of people right now. I'm really excited to. At least 20 to 30 people to add to our team so we can keep on growing and getting more clients. We've been around also for about like 50 years. This particular office in Fresno, I would say it's probably been about 30, but don't quote me on that, but it's been a while. So we have been, I would say, the biggest agency in Fresno that's doing this right now.
Wow, that's good. And do you get clients from just Fresno area, or do you get them from all over the valley?
Yeah, so we don't only serve Fresno, we serve the South Valley as well and Madera. So we'll go to Madera, and then the South Valley will cover Selma, Hanford, Visalia, and we will even go as far as Tulare. So we try to cover every area.
Yeah, that's good. Okay, so what type of positions are you recruiting for?
We want to hire caregivers. We want you to have at least 1 to 2 years of experience being a caregiver. We do ask that it is not taking care of family members. Although that's great experience, we do ask that it's somewhat professional. Maybe it be like a privately paid client that would be considered experience. Or if you have experience working in a nursing home, that would definitely count towards the experience that you need to work here.
Okay, great. So when one applies, do they need to have some kind of certification, any kind of credentials, or?
To apply, no. Eventually, I could walk through any applicant through the process of getting registered through the state of California. Really what that is just basic fingerprints, which is very easy. You don't have to go to school or anything for it. But to apply, I welcome everyone to apply. And then I let them know that, hey, like you do need to register through the state of California. It's part of a new law as of 2016. But I can definitely help applicants do that and get them registered as a home care aide. It's a very simple process. Like I said, it's just fingerprints.
Yeah. What shifts do you have?
So the beauty of healthcare is that there's all shifts. Everyone needs help at all times of the hours.
Right.
I would say mornings, afternoon, and nights. So this is great for students or people that are just looking for part-time work, or if they want to work full-time, we can definitely keep them busy. And we can be flexible with their scheduling. A lot of clients are flexible, so the hours can vary based on your availability. We're going to try to staff accordingly.
Okay, great. Okay, I'm sorry. Did you state the type of positions do they have a certain title or?
I have them all listed right now as caregivers. If you're a CNA, of course, you can definitely apply. That means that you have a lot of great experience. Or a personal care aide, if you worked as a personal care aide, that would be just as great as well. But I have all our positions right now listed as either home care aide or caregivers. Okay. It's the same thing.
Mm-hmm. Yeah. Okay. Now, how does one apply? They go on your website and apply?
Yes. We have our jobs a couple different places. We have it on mycnajobs.com. And then we also have a main website, which I think is the best way, is it's called careers.hireology.com.
Okay. So careers, I'm sorry, can you say that again?
Yeah, absolutely. It's careers.hireology, which is spelled HIREOLOGY.com.
Could you
write it on the chat?
Yeah, could you do that?
Thank you.
Sure.
Sorry for interrupting.
Yeah, no problem.
All right.
I have a question. Do you guys hire people without experience?
Right now we are not. So what I do tell people, like, you can even try to apply at some competitors or gain your experience by getting a private client. And then once you have that 1 to 2 years of experience, definitely come to us and apply. We do have, we pay competitively. So if you try to gain that experience, even if you want to do like a short-term CNA program and get some experience, we may welcome new CNAs in the future.
That's a good question. I have a friend who's very involved with, well, she was with the Cancer Society and they closed, unfortunately, but she does help people with cancer. But, if people want to get the experience, what organizations in town can they call to see if they can help, with people, especially some people drive people around who go to need appointments and so forth. But do you recommend them calling, any organizations in town so they can get the experience? I know you said competitors, but
I would say even like a private client to gain your experience, or to do a CNA program that's going to probably take you a few months, like 3 months to complete. That would be really good experience to get your foot in the door somewhere. You used to be able to volunteer a lot of places prior to COVID. I'm not sure if they're still doing that, and you can get some experience there.
That's a good point, COVID. Yeah.
I know that there's some apps now where they set you up with clients, and you can, get your experience there, some privately paid clients, and then definitely come at me then and be like, hey, Laura, I got that 1 year or 2 years of experience. Are you still hiring? And my answer is going to be absolutely. Come and apply. Come work with us.
Yeah. Okay, good deal. When you interview somebody and they have the qualifications, let's say you're interviewing 2 or 3 people and they all have the same qualifications, but what makes one stand out more than the other that you're going to say, okay, I want you to work for us? What is the quality or qualities do you look for in a person? Sure.
Compassion. You have to have compassion in this industry. Otherwise you're not going to make it. And people can tell right away. The clients can tell. So please have compassion. And then also, just a few pointers for any type of interview. Be on time. That's really important for here at Interim, because I know if you're on time for your interview with me, then I know that you're going to be on time with your clients. And the clients, we don't want to keep them waiting. So don't keep us waiting either.
I agree with that. I totally agree. Okay. Writing a cover letter, or did if I asked this already, or letter of interest or resume, do you recommend somebody doing that when applying and attaching it to the application?
It doesn't hurt. So if you have one ready and handy, why not? You're just going to stand out. I would definitely have a resume though attached to your application. I love looking at resumes, and then it lets me know that you put some time into applying, and I can appreciate that in an applicant.
Mm-hmm. That's great to know. What is the dress code for your position? Do you require a uniform? Is it casual wear or
You know, you're I would say for this type of work, it's best to come in scrubs, closed-toed shoes, obviously. And there'll be some cases where clients, if you're going on an outing with them, which is always fun, that used to happen before COVID as well. But a lot of clients want to go out to lunch, or they used to like to go to the casino, and then they would request that, their caregiver wear regular clothes because they didn't want to feel like they're at the casino, with someone that's taking care of them. So it could vary, but we'll let you know. But for the most part, it would be scrubs.
Okay. That's a good question. If they're going to go to the casino, now who does the driving? Does the caregiver do the driving?
Most of the time, yes, but they'll be reimbursed, and they don't have to. If they don't want to drive, then we would staff someone else. But if they're willing to, then go on like a little fun adventure with the client, then we would definitely take care of the mileage for that.
Okay. So someone needs their California driver's license to apply.
For those types of cases, we have cases that don't involve driving, so it is not required. There are cases that you're just going to be at the client's home all day, and it doesn't require that you need to go out anywhere.
Okay, good deal. Okay. What is the growth potential for employees working for you? What lies ahead for them?
We are always encouraging education here. And there's plenty of room to grow. So if like I started as a caregiver here and I worked myself way up, there's also, we definitely encourage people to go on and get their home health aide license or even nursing. We have nurses here as well. So we have LVNs, PTs, so we're always encouraging education. And so I think that there's a lot of room to grow with the company. And, sometimes we can even, if it feels like the right applicant or employee, we might be able to sponsor them in building them from, a caregiver to a CNA to maybe an HHA. If they have that compassion, then maybe we can sponsor them in the future.
Okay, great. Okay. Do we have any questions out there for our students and alumni and guests to ask?
We do. We have a question.
Okay.
So someone's asking about their CNA certification. It had just expired last year. Can I still apply? Absolutely. If your CNA is expired, that doesn't disqualify you. You still have the experience working as a CNA, which is perfect. It's not required for the position. So definitely please apply.
Great. These positions are so important. I haven't gone through my own family issues. My dad, having a caretaker, it takes a special person, and it takes a quality that very few people have, in my opinion. It takes patience, understanding, being committed. It's not an easy job, but it's so important to the family to have a caretaker, and what they do for the family is beyond a measure. They take a lot of stress off the family for sure. I know my mom was just running ragged 24 hours a day trying to take care of my dad, and it really took a toll on her. So caretakers are amazing. And I think it's such a great experience because if you want to go into nursing later, it's something you can put on your resume. It's something you can almost brag about because of the experience that you get. It definitely transfers over to the nursing industry, a nursing position, or even, you go beyond a nurse. I think it's huge. And we're having the baby boomers, they're A lot of them are retiring now and they're getting older, and they're going to need a lot of help. And a lot of a lot of them don't have family too. And that's important as well to help them out. So thank you for those who are choosing this industry. So it's really important. Gosh, what else can we tell people about being a caregiver, about your company?
We do offer free education courses. So I would like to build off of what you said. We can get you trained and learning a lot about this. And you can also, like you said, go to a nurse, to like an NP. There's so much room to growth, and we can help you and guide you in the right direction with that.
That is great. Now, people can go to school at the same time and be a caretaker. So your hours are very flexible too, correct? Or they can go to school during the day and be a caretaker in the evening, afternoons, weekends.
Absolutely. We have a lot of students. We have a lot of people in the nursing program who are caregivers on the side, and it almost kind of helped them get into the nursing program because they had some experience, depending on what type of, if it was the lottery system or whatnot, it helped them and they had more experience. So they're not going into the nursing world blindsided in a sense.
Yeah, I that's a good statement. And I know nurses are fantastic people too. I've seen that firsthand, and their patience and their care and just the way they approach a patient. It's so endearing. I don't know. I don't want to say endearing, but it's just so caring and so gentle. But getting those skills can come from being in a job like with Interim and developing and becoming connecting to people, learning how to connect to people, especially with people with Alzheimer's. I don't know. What do you think? Alzheimer's you got to care for them differently at times than somebody who has cancer or somebody. I don't know. What do you think?
Yeah. It's sometimes the approach could be a little bit different.
Yeah.
No matter what, though, it's rewarding either way. I will tell you that from experience. This is a very rewarding career, but your approach might be different depending on no matter who the client is. Yeah.
Yeah. And, another friend who was older and she was in my neighborhood, she had a caretaker come and she was the neatest person you ever want to know. And you can learn so much from your clientele and be a part of their lives. And just the social aspect makes them feel so much better to have somebody help them out. And that way, I think that could be a great experience. As a person who lived along, has so much wisdom they can offer and give, and you're giving them so much compatibility, because when you get older, it gets lonely sometimes, and that loneliness can really affect somebody. But a caretaker can really make a difference for that person and make their life great. So thank you for doing that.
Yeah, we're like their companion. They appreciate us. They're so excited when we come. And that also makes us feel good when we go out there about our job. Like, they're excited to see us. They look forward to our caregivers coming out.
Yeah, great. Now, a background check, when you do a background check, does it have to be a perfect background check? And I don't know what you look for, or what would disqualify somebody, from applying?
It's up to the Home Care Aid Bureau of California. And some things that I've seen, maybe like stealing or something, something major, something that would harm elderly, like that might disqualify them, but that will be up to the Home Care Aid Bureau to decide. So after you do your fingerprints, you should know within a few days whether or not they accepted you or not. We never get to really see what they did or not, but it will tell you whether they let you register or if they didn't let you register. And that's just an example. I think like grand theft or something was something that disqualified someone.
Yeah. Okay. Yeah. Okay. So, but that's important that you do check for that. Just like daycare, they have to go through the background check. So it's important to do. and know. So
Yeah.
let's see what else. Again, if you can let them know how to apply, and that is, I just wrote it down. Where did it? Oh, careers.hireology.com, and it's in the chat, correct?
Yes, I already put it in the chat box. When you get to the website, you can pick what location you want to apply for. Right now, I have positions listed for not only Fresno, Madera, and Selma, and probably Hanford right now. There's also a position for the South Valley. So if you live anywhere in Tulare or another town nearby, definitely apply. There's probably clients in that area as well.
Okay, very good. Okay, I think, gosh, is there anything else we need to, mention, or anything else?
I feel like we pretty much covered everything. But yeah, definitely just come and apply. You can also call me directly. I love that. If you call me on my direct number, I'll answer and have you fill out an application. I can walk anyone through the application process that needs help. I'm always there to help you.
Okay. What is your number?
Okay, so it's going to be 559 224
okay
0668, and then just ask for Laura, and I'll be happy to help any applicants.
Okay, that is perfect, because sometimes and students have to realize when filling an application, it needs to be perfect, and if you can get the help, that would be great, because there's some things if you do it wrong, it's going to definitely affect your to get an interview, and you don't want that to happen. So I do encourage people to call if there's an issue with the application process. Yeah. And also, people who get an interview, we can help those who need interview assistance here at the City College in our department. Please call our department at 442-8294. You can ask for Cindy Dunn. You can ask for me. We can go over the interview process. One thing I want to ask you, what questions do you ask in an interview, if I can ask? I mean, what important questions do they answer?
I'll give you an example. Like we might give you a scenario question, but it's not a hard question. It would be like, if you're expected to be at your client's home at 8 a.m., but you got a flat tire, like what would you do in that type of scenario? We might also ask you, what made you decide to get into this field? It's always interesting seeing people's answers with that question, because this is the type of field that, you have to be a certain type of person to go this way. Some people, you're not going into this field to become rich, but you could obviously make money, but you have to really want to do this type of work and take care of people and be the right type of person.
Yeah, that's true. That is true. Wow. I think we got a great synopsis of who you are, what you do, and why you do it. And you've been around for a long time. I know that. And we talked about that earlier. So I encourage people to apply. And if they need help, you can give us a call or give Laura a call on the application and go from there. So there is a need out there for sure. So, and also this is, once they, they do time in this industry, it's always nice. The family, I'm sure, are very appreciative, and I'm sure they'd be willing to write a letter of recommendation or a letter of acknowledgement on their work that they did with their family member. And you can put that in your portfolio, and that can make a huge difference for promotions, going up in the industry, within the organizations, or if you're planning to say become a nurse, and you can use that letter in your application when you're applying to say Agnes Community or whatever. So there's always a lot of positive things that can happen. So have you had that happen where people have called in and said this person has done an excellent job, we're so grateful? Or
yes. We love when clients call us and tell us that, and we will also be happy to write recommendations as well, to help, whether it's to get into nursing school or whatever the case may be.
Wow.
But yes.
Okay. That's great. I'm glad I asked that question. That's fantastic. Oh, good. Okay. If we don't have any questions, I think we're good. Hurry if you do, because last time we had somebody ask a question that an employer left. So,
oh no.
Yeah. Laura, you've been great. You've been really, truly great.
Oh, thank you.
Thank you very
yes,
much.
thank you so much for having us. We can't wait to see who applies.
Yeah, I agree. And again, this is recorded and it will go on our website hopefully Monday, if not tomorrow. And it's going to reach out to more people, not just, today, but a bigger audience. So.
Wonderful. Thank you so much.
You're welcome. Have a great afternoon.
Okay, you as well. Thank you.
Bye-bye.